Hi, welcome to J Sweat Plastic Surgery. I'm Dr. Jeffrey Sweat. You're being asked to watch this video today as a general introduction to the practice. It is our goal here that you are taken care of in a state-of-the-art facility, but also that we make sure that you're comfortable and that all of your questions are answered. This is definitely a team approach. As an individual surgeon who operates anywhere from 3 to 4 days a week, I rely on my team around me to help with your care throughout the entire process. I've also surrounded myself by people who are highly educated about what we do, so oftentimes they will answer your questions. If you have any questions that they can't answer, obviously they'll talk to me and we'll make sure that we have all of your questions answered. But it is important to understand that it is a team approach, and oftentimes throughout the surgical process you will interface with me from time to time, but you will often interface with my staff more frequently than you do with me. And this is so that we make ourselves available to you at all times and any time that you have problems. Obviously, we will provide you with an emergency number that you can call after hours, but when our office is open, it is always best to call the office to get the fastest response. If you have any questions or concerns about the process and how we are taking care of you as a patient here at J Sweat Plastic Surgery, please don't hesitate to ask. Thank you and welcome to the practice. The purpose of this video today is to discuss gynecomastia surgery. Gynecomastia is the medical definition of when a male develops breast tissue that is larger than he would like. It is important to understand that all mammals have breast tissue, thus all men have breast tissue, and in fact 1% of all breast cancers happen in men. Gynecomastia is the term in which the breast tissue becomes larger than what we would aesthetically like it to be, sometimes even to the point where it appears as though a man can have breast tissue. When it becomes aesthetically unappealing, the surgery to remove the breast tissue is mainly done through an incision around the nipple in order to be able to remove the breast tissue itself. If there is fatty excess on the individual, occasionally we have to do liposuction in addition in order to contour the surrounding area. Occasionally, if the gynecomastia is significant enough, it can also require reshaping of the chest itself to remove some of the excess skin, but that usually only happens in the severe cases. Obviously, I'm going to make a recommendation for you individually based on your physical exam. The most common concern after gynecomastia surgery is actually contour deformities. It's important to understand that the breast tissue is mixed in with fatty tissue underneath the nipple, and the removal of that breast tissue requires the removal of the surrounding fatty tissue, which can then leave a dent or a divot in the chest. That's why occasionally we have to do some liposuction to help improve the contour as well. The idea behind it is we remove all of the breast tissue if we can, but it's important to understand that breast tissue visually does not look any different than the surrounding fatty tissue for the most part once the surgery is done. Thus, there can be little fingers of breast tissue that are not removed, and the gynecomastia could come back with time, although the risk of that happening is very low. The reasons for gynecomastia can vary widely, and that's why we've asked you the various questions that we have regarding your medical history. If you have a significant history of using marijuana, steroids, medications that would you use for gastric reflux, or if you have a family history of breast cancer or breast enlargement in your family, those are important things for us to understand so that we can also make sure that there's not a significant risk of developing breast cancer or other significant issues that we would have to deal with. The surgery itself is usually done under IV sedation, which is the same as twilight, or conscious sedation is another term for it. Basically, what we're going to do is start an IV in the back of your hand, make you sleepy, and then I'll inject numbing medication around the entire area where I'm going to work. And generally, you'll just snooze through the procedure. When the fullness of the chest is simply from fatty tissue, it may not require an incision around the nipple to excise the breast tissue. But most commonly, there is some breast tissue that's left behind, and so most commonly an incision is made around the lower surface of the nipple. Because we're removing the breast tissue from the posterior surface of the nipple, that can interrupt the blood and nerve supply, so there can be change in nipple sensation, increase, decrease, or more commonly, loss of nipple sensation, and it is even possible to lose the nipple, although that is a very small risk. The surgery itself is done as an outpatient surgery. You're going to come in the morning of surgery and go home that same day. Depending on the severity of the breast enlargement or the complexity of the operation, it is entirely possible that you may have drainage tubes that usually stay in for a few days after the surgery. If we don't put the drainage tubes in, there's a risk of developing a fluid accumulation or even a blood accumulation in the space where the breast tissue is removed, and that's the reason for the drains. It's also the reason that we put you in a compression garment when you wake up from surgery. In other words, when you wake up from the surgery, you'll be in a compression garment that we're going to provide for you. That compression garment is to be worn at least during the day and night for 2 weeks after surgery, upwards of 6 weeks after surgery if you can tolerate it. It is super important that you're up moving around as soon as possible when you get home from surgery. Every hour or so, you should get up, go to the bathroom, get yourself something to eat, but just be up moving around the house. If you're laying around in bed too much, there's a risk of developing blood clots in your legs. Those can travel to your heart and lungs, and that can be fatal. We don't want to have that happen. So it is super important that you're active after surgery. But at the same time, it is also important that you give your body time to heal. You will need to stay out of the gym, avoid heavy lifting and aerobic activity for anywhere from 2 to 6 weeks after surgery, depending on how you're healing. Ideally, we would take 6 weeks off. If you have any questions or concerns after you've watched this video, please feel free to ask me.